Bonjour à tous et bienvenue dans notre premier podcast. Aujourd'hui, nous allons parler du cancer, les symptômes et les traitements. Nous avons avec nous Dr Veenoo Agarwal, qui est un oncologue médical. Il a obtenu son diplôme de CMC en 2000. Il s'occupe activement des patients depuis plus d'un quart de siècle au Royaume-Uni, en Australie et maintenant en Inde. Au cours des 10 dernières années, il s'est consacré exclusivement à la prise en charge des patients atteints de cancer. Il est le chef au département d'oncologie médicale à l'hôpital international Shalby à Gurugram en Inde. Bonjour Dr Veenoo, je vous souhaite la bienvenue dans le podcast.
Thank you, Mrs. Benny, for your kind introduction.
Avant de commencer, nous aimerions savoir ce qu'est un oncologue médical.
Thank you, Ms. Benny. This is an important question. A cancer in itself has three main kinds of treatments. One is surgery, second is radiation, and three is drugs or medicines, or also called systemic therapy. And all these types of therapies have their own specialists. Like surgery is done by surgical oncologists, radiation is done by radiation oncologists, and the third kind of specialists or the medical oncologists who are like me, who are specialized in giving systemic therapies. And systemic therapies are basically medications that try to dissolve the cancer with just medicines. For example, we have chemotherapies, which are the traditional treatments of cancer. We also have hormone therapies, where either we are trying to give body's own hormone in concentrated fashion, or trying to give medicines to block the body's hormones acting in a detrimental fashion or running the cancer. For example, in prostate cancer, we are trying to block the action of testosterone on patient's own body cells to try and prevent it running the cancer. Then the third kind of treatment is the newer treatment, which is the immunotherapy, which is making the immune system or patient's own body's immune system recognize the cancer and try to clear the cancer for us. The other types of newer medications are targeted therapies, where we are using the weaknesses in cancers or mutations in cancers to block them or exacerbate them to prevent it spreading the cancer. And the last one is the ADCs or Antibody-Drug Conjugates, which is a combination of either immunotherapy or targeted therapy with chemotherapy, which is two medicines rolled into one, and that helps the like a target bomb, where we are trying to prevent the cancer running with precision-guided chemotherapy.
Docteur, vous vous occupez des médicaments administrés aux patients et vous dissoudez le cancer à l'aide des médicaments. Le cancer, un mot qui fait peur à tant de gens. Mais qu'est-ce que c'est exactement?
Thank you, Ms. Benny, for that question. It's an important question because we start with understanding what cancer is. All our body cells have a tendency to divide, and that division is necessary to replace old cells or damaged cells and also to form new cells. Whenever new cells are born, the old cell has to copy its DNA into the new cell. And when this copying process is happening, sometimes there is mistakes that happen. These mistakes are called mutations. Most of these mutations are benign, which means that they don't lead to diseases. However, when mutations happen in specific area of DNA, sometimes the cell loses its tendency to stop dividing or is excited to keep dividing. And this uncontrolled division of the cell forms a tumor, and hence the cancer happens.
Wow.
And this is where we need to understand, in short, that a cancer cell is body's own cell that has gone rogue and keeps dividing uncontrollably.
Le cancer est une de nos propres cellules du corps qui se divise de manière incontrôlable. Dr. Veenoo, quels sont les symptômes du cancer?
Thank you, Ms. Binney, for that question. This is a common question that I'm asked because everybody wants to know what are the early symptoms of cancer. Unfortunately, there is no single symptom that if you have that, we can say you have cancer. Cancer is collection of diseases in different organs. So the symptoms depend on what kind of cancer you have or where the cancer is starting. For example, a breast cancer presents as a hard lump, or it can present as dimpling in the skin, abnormal discoloration of the skin of the breast, abnormal discharge or blood through the nipple, and abnormality in the nipple. Similarly, colon cancer can present as slight bleeding in the intestine, from the intestine or the stools. It can present as obstruction or tummy pains. All these symptoms are different and are quite varied. In short, if you want to understand or be lookout for symptoms of cancer, I would suggest if there is any symptom that is getting worse or is not going away or is coming back again and again, one should get it checked. It does not mean that you have cancer, but it does need to be seen by a specialist so that one can investigate it properly and diagnose the disease as early as possible.
Si j'ai mal à la tête presque tous les jours, est-ce que cela signifie que je ne dois pas l'ignorer et je devrais le faire vérifier?
So that is correct. So if you have a headache that is not going away, it does not mean that you have cancer, but you should get it tested appropriately so that we can understand what is happening, why it's happening, and whether this is anything to worry about or not.
Quels sont les examens qu'il faut faire?
So, for a good treatment and understanding of the cancer in a patient, there are multiple investigations that are required. And there's not just one investigation that gives us everything. Each investigation has a different job and looks at the cancer from different perspective. For example, most of the patients come to me after having had some sort of a scan, like a chest X-ray, they found a spot, or in the CT of the tummy, they found a spot. So what we have to do is first look at where all the spots are, which means that looking at doing a full CT chest abdo-pelvis plus or minus a PET scan. That helps us give an idea whether the cancer is at one spot or has gone into different places. Also, it gives us an idea how big the cancer is. Then one of the most important tests that we have to do is a biopsy, which diagnoses the cancer and gives us certain idea about what treatments would be useful.
Vous utilisez plusieurs examens pour diagnostiquer le cancer et trouver le bon traitement. Pourquoi la biopsie est-il absolument cruciale dans le traitement du cancer?
Mrs. Binney, the biopsy is the single most important test these days to figure out what's happening in the cancer. So what we do in a biopsy is take a small piece out of the abnormal tissue that we think that is there in the scan. That small tissue can be taken either by a needle or by a surgeon or various ways. Once we have that tissue, we stain it and look under the microscope. It diagnoses with 100% certainty that indeed the patient has cancer, and not only just cancer, but what kind of cancer it is. Further, we have to then stain it to look at where that cancer is coming from. Because if you have a spot in the liver, it firstly doesn't definitely mean that that's cancer. Once we know that that spot is a cancer, we have to figure out where it is coming from. It could be just from the liver, or it could have come from different organs like colon, lung, breast. All these go to the liver. Just because they go to the liver doesn't make them liver cancer. It just makes breast cancer gone to the liver. And therefore, the treatment depends on that. And further, this tissue is used in certain modern testing like next-gen sequencing, which tells us mutations or weaknesses in the cancer that we can target or use them to decrease the division or the rate of growth of cancer by target drugs or precision guided bombing to the cancer. So, in short, biopsy is the single most important test that not only helps us to diagnose the cancer, but also helps us to decide what treatment would be effective for that cancer in that patient, making the treatment highly personalized.
C'est très clair, docteur, que la biopsie ne sert pas juste à confirmer le cancer, mais aussi permettre de trouver quel type de cancer.